Good morning to all, and thank you for giving me this opportunity to talk to all of you. Although, because I'm located in Hyderabad and because of the approachability issues and the timing constraints, I am not able to be there physically. However, I would have loved to be there, and it would have been my pleasure to be a part of the entire event. And we would. I know that we would try to have a live session, but however, because in case it's not happening, so that's the reason this video has been recorded. I don't have a PowerPoint presentation to be on, straightforward. I'm telling you that I don't have a PowerPoint presentation. I don't prefer to do it a PowerPoint presentation way. We'll just have a chat on, we'll discuss about a few things. I've been given the topic of how the insurance industry is impacting ophthalmology practice financially. And this is something very, it's a very huge topic. We can discuss it on lengths together. And, as for an introduction, I'm Dr. Hari here, and I am a practicing ophthalmologist, just like all of you, a part of you, and a friend to you. And I learned about insurance and the health coverage for health insurance for ophthalmology by my own experiences by running my own hospital, and went into the details. So it's not what it sounds like. People think that it's a very difficult thing to handle, but no, I disagree strongly, because I find it very easy, very convenient to handle insurance cases. Now, coming to the topic that I've been given to speak to you, insurance is a financial agreement. It's a financial agreement of indemnity. Okay, so insurance started from years together when people used to go on ships for exploring places and trading. So they used to have an insurance on the ship. So over a period of time, for healthcare also, the insurance industry came up, and insurance is an indemnity. Understand that insurance is not an investment. So if somebody tells you that I pay so much premium for the insurance, health insurance, but I have not claimed anything till now, then I would say, see, it's a good thing. You never had to claim health insurance. That's a good thing. That means you're healthy. So health insurance is for the time of need. It's a safety net for an individual. It's not that you should be utilizing the sum assured every time. If you don't utilize it, that's good for you. But however, insurance, as I told you, it started off with health insurance. When it started off, ophthalmology was not covered. Okay, ophthalmology, dermatology, a lot of other specialties were not covered. Only for emergencies it came up. However, over a period of time, with increasing product awareness and increasing paying capacity, ophthalmology is also being covered under health insurance, just like a lot of other specialties which came in. So over a period of time, the insurance industry has evolved to issue insurance policies which cover for ophthalmology also. Now, what happened over a period of time is that, I don't want to go into much of the history there. So we come to the COVID. So when the COVID struck, that's the time a lot of people realized that healthcare is an expense which can make them bankrupt overnight. So because of which the penetration of health insurance increased like anything, and a lot of people bought health insurance just out of fear, out of the entire experience they had during COVID. And also a lot of employees, the employers started providing health insurance coverage for the employees. I myself provide health insurance coverage for my employees. It acts as a very good retainment technique. They tend to stick with you because they know that the value is not in the salary only. The value is about the support that they receive. So after the COVID pandemic, there's been a huge surge in the number of health insurance sold by insurance companies. This basically retail. Now understand that in ophthalmology, most of the conditions, 90% of the cases are cataract, and cataract being an age-related condition, insurance companies put a waiting period on them. Now, what was the waiting period? It's normally 2 to 3 years. And understand that after the COVID pandemic, now the waiting period is hitting. We just crossed that 2 to 3 years. So whoever has bought the health insurance post-pandemic, their waiting period is finishing now. And now they are going to utilize their health insurance for the ophthalmology treatments. Now, that's the reason a lot of hospitals would now be seeing a surge in the number of insurance cases that they are encountering over a period of time. The hospitals which used to be only cash patients with walk-in patients are now having more and more number of insurance cases, and the numbers are increasing day by day, and the number of cash patients are reducing day by day. In addition to that, there are other funding options like Ayushman Bharat and the state government schemes, ECHS, EHS, EJHS. Those so definitely. But however, the interesting part about health insurance industry is that when you talk about health insurance, it's a private enterprise purely. It's a business agreement. So you will find a higher paying capacity in them. You will find a higher ticket size. You will find a better patient coverage on that. So now it's increasing. So coming to a normal tier 1 city like Hyderabad, I'm from Hyderabad. 90% of my cases are covered under health insurance, and 90% of my cases I opted under insurance. In tier 2 and tier 3 cities also it is increasing, especially in tier 2 tier 3 cities where people have migrated to tier 1 cities for job in terms of IT or corporates. Their parents back home are going to be covered by the insurance from their employer. So this leads to the parents seeking healthcare options where the coverage for the insurance is there. So as of now, although few hospitals will say that no, we are fine without covering for insurance, but over a period of time they are not going to be able to cope up without cashless services and insurance coverage. So few of the hospitals tell me that no, I don't get insurance patients. See, understand that it is not that you might not be getting any patients inquiring for insurance. The reason being that these patients walk into those hospitals only where the insurance is covered. So even if you have a patient who is just next door, will not come to your hospital, but they would prefer to travel 5 to 6 kilometers away to another hospital just because that particular hospital is covered under the insurance. So because of that, you wouldn't even know what you have missed as long as you don't have the cashless services in your hospital. Now, coming to the financial impact of health insurance on ophthalmology, I would divide this into two parts. The first one, and most important that everybody would be curious to know, would be the impact on individual hospitals and clinics. And second would be on the practice of ophthalmology as a whole. Now, coming to the impacts on individual clinics, these clinics and hospitals which are standalone or a part of a chain, which are individual hospitals, they have few pros and few cons just by taking insurance empanelments. Now, first pros would be the footfall. As I told you, these patients normally look up for hospitals which are in their network in order to seek healthcare. Just by being a part of that network, you tend to have a higher footfall compared to other hospitals which are not part of the network. Now, it's not only that particular patient who has an insurance coverage. Once that particular patient walks into a hospital, avails the treatment under health insurance and has a good experience, they will go home, and it is a multiplier effect. Now, most of the places a patient has got a bad experience. In majority of the cases, the ophthalmologist and the healthcare delivery is not a problem. But पेमेंट ज़्यादा है, बिल ज़्यादा आता है, यहाँ का पेमेंट मुझे बहुत खर्चा हो गया. Those are the most common complaints that patient have with healthcare. But when a patient who is coming through insurance, they generally tend to go back with a happy note. So they tend to become your further marketing multiplier. So footfall is one of the biggest aspects in terms of insurance. Second is you tend to get more number of premium cases, because as of now, health insurance coverage for any individual through a corporate plan covers for around 30 to 40,000 at least per eye for cataract. Now, in a tier 2, tier 3 city where people tend to operate for 15,000, 20,000, going for Indian make monofocal lenses, in that situation, a 30,000, 40,000 payout is a very welcome change. And another thing is that these patients, since they don't have to pay out of pocket, they generally don't end up bargaining. They don't bargain with the counselor. There's no that entire ki, sir, thoda aur kam kar lo, I'll pay the balance later, my uncle has to come, my son has to come. These kind of excuses you generally don't find. You have a fixed tariff rate. They don't bargain for the discounts much. When they have an insurance, you have your rates fixed. You know how much the insurance company is going to pay you for this. They know how much the insurance company is going to pay you for this. They don't have to shell out. Whatever they have to shell out is clearly mentioned in the insurance documents. So when it is documented in front of them, that helps them a lot in terms of understanding an entire concept. And they don't bargain much, and maybe you can add some freebies and all, maybe complimentary eye drops or something like that. That's up to you. But it leads to much lesser chair time with the counselor and the financial explanations. So those things are there. Next is about upgrades. So now when a person has got a health insurance coverage, they can take the treatment from a hospital in two modes. One is reimbursement and second is cashless. Now during reimbursement, what happens is the individual has to shell out the money from his pocket first. So he shells out the money from his pocket and then claims the amount later from the insurance company. In that situation, what exactly happens is that the individual will shell out only that much amount of money that he can spare. So even if his son is working in Dell or Microsoft in a city like Hyderabad or Bangalore and has got a coverage of around 75,000, 1 lakh per eye for cataract, their parents back home are reluctant to spend more than 15-20,000 for cataract surgery because their neighbor got it free in a camp. Understand the situation. So even how much ever you tell them that this implant, that implant, this technique, whatever, so it's not going to sell very easy. But however, when you do it under cashless, where the individual doesn't have to shell out anything from his pocket and the payment is directly received by the hospital, that acts as a boon for the hospital. These patients tend to upgrade to a higher package very easily, higher implants very easily, and they don't shy away from going for an Alcon or a Johnson & Johnson implant instead of an Appasamy or a Care Group implants. So that leads to a higher payout for the hospital. Now understand that this is a payment payment guarantee system, where it's a credit billing system, where the service is delivered first and the payment is received later. A lot of hospitals do complain that the payments are delayed, but I generally don't find that a problem, because once your systems are streamlined, the payments are never delayed more than 2 to 3 weeks. Now, this kind of a benefits don't come cheap. It comes with its own issues, its own complications. Let's look at what are the complications which maybe has got a financial implication as well. The hospital itself, in order to attract insurance patients and to process insurance patients, requires trained manpower who can handle these kind of cases very easily. So one of them is the counselor, who should be very much abreast with the facts and figures of the insurance process, so that they can explain to the patient better and counsel the patient in a good way, that the patient gets converted to you on a better ticket size, and it goes on the patient understands the process well. So for that you need skilled staff who can handle it. Counselors, even the person who is doing the billing, needs to take care that he is correct in his process, and and because if the process is not correct, your payments are going to be stuck, your payments are going to be delayed, you are not going to get the best out of the insurances, and that's going to hurt you. So for these kind of staffs, it is very, very important that you pay them well, you maintain them well, and which is definitely an expense. So instead of getting a staff for something like 10 to 15,000 or 20,000 per month, you might have to shell out 25 to 30 to 40,000 per month. So that is an expense. But however, when you look at case-to-case basis, on a monthly basis, you will realize that you are doing much better with a set of trained staff rather than untrained ones. So the staff expenses is definitely there, but I would say that it's definitely worth it. Now, there are a few losses as well. Few hospitals end up getting lower settlements than what the credit note says. So those kind of cases is something that you need to watch out for. And I would say that it does not have anything to do with the insurance process as per se, but when you don't understand the process and you don't work according to the process is when you tend to get some losses. So you need to understand the insurance process, you need to understand the entire tariff list, the agreements, how to bill, how the entire billing system works, and what are the limitations to it. So if you understand that, you will not have any loss. So I can proudly say that in the last 6 years that my hospital is up and running, I had an unexpected deduction. When I say unexpected deduction, that a situation where the insurance company deducted an amount which I was not expecting them to deduct. So I had only 2 such cases where I do around every month 30 to 40 surgeries under insurance. Okay, so I only had 2 such instances in last 6 years. If I can proudly say that, that's purely because the process, the billing systems, and the staff that I maintain. Now, another downside of it is, multifocal lenses, multifocal and premium implants. So if you realize, a lot of hospitals has got at agreed tariff rate, and that agreed amount, which caps a lot of things in the agreed tariff rate. So here you should understand your tariff rate. You should negotiate a the wordings in the tariff rate should be clear. It should not mention monofocal. It should be open to other implants. It should not be like a generic kind of a open-ended tariff. It should not be. Open-ended tariff means, if I say cataract surgery 25,000, so basically the problem is that irrespective of any implant you put, you are going to get 25,000 only, which restricts your choices to a large extent, which should not happen. So your entire effort should be focused on wording the tariff document correctly, and legally you should be correct, because as long as you are legally correct and your tariff, you uphold the tariff agreement and do your billing according to the standards, you are not going to lose even a single rupee out of insurance process. Now coming to another cons is the limits. So health insurance policies have its own limits for cataract surgeries. Understand why is it so is because if there's a person who has a 5 lakh policy, insurance company knows that cataract is an eventuality. It is not an indemnity. It's not an accident that somebody has got a cataract. Just by virtue of age, that person is going to get a cataract. So they don't want the individual to squander the entire sum assured on a single cataract surgery, which is going to be a loss for them. Just imagine an insurance policy with 10,000 premium or 20,000 premium, you with the 3 lakh rupees coverage. That's it. So 3 lakh rupees coverage, the individual pays premium for 30,000 for 3 years, and after the end of 3 years, the waiting period is over, he puts in a claim for 1.5 lakhs. So that's a loss proposition for the insurance company. Understand that insurance companies are business houses. They have their profit and loss statements, which needs to make sense. So what they do is they limit and cap certain procedures, that how much is payable for each procedure. Cataract is one of those procedures. Second in ophthalmology is intravitreal injections. Intravitreal injections, I'll come to that. Now, these limits are something that we cannot do anything about it. It's not in our hands. But it's very important for us to understand it so that we can explain to our patients that what these limits mean, and the fact that insurance company is not liable to pay anything more than this limit. So that is something that we should explain to the patient. So these are few points that which I can say a clinic or a hospital benefits from taking up an insurance cashless service, or giving a anywhere cashless kind of an option. So it leads to an increase in footfall. It leads to higher premium cases. The bargaining and the time required by the counselor reduces, and the patients who are going for a lower package earlier tends to upgrade. And the other cons that I said, the staff and the losses and the higher premium implants and limits, these are something that we can tackle very easily with adequate training and adequate methodologies. Now, coming to the problem that ophthalmology as a practice faces because of the insurance industry. It's pretty much interesting because as the time goes, the practice is changing drastically. Independent doctors have moved into corporates. There is consolidation in many places. There is acquisitions and mergers. So with the same thing is happening in insurance industry also. Over a period of time, they are also learning better, and they are also trying to cut the losses. So understand that ophthalmology is one specialty which fields in the maximum number of claims in terms of numbers. Yes, although the ticket size would be lesser, our surgeries would be 20,000, 30,000, 40,000, maximum to maximum 1.5 lakhs. So compared to other hospitals, cardiology or orthopedics, who generally foot in below 5 to 6 lakhs at the same time, onco can go to any limits. So thing is, compared to them, our ticket size is smaller. But the thing is, our number of claims is very high. So because of that, ophthalmology becomes a very important specialty for insurance industry. It's very fast paced that our process and treatment, delivery and discharge is faster than the time taken for the insurance company to process the claim. So that also becomes a challenge. Over a period of time, yes, these things will be better. And in ophthalmology, there is something called patient choice. So the implant is majorly a choice of the patient, where the patient chooses the implant. So that kind of a flexibility is not there in many other specialties. Yes, in few it is there, in for example in orthopedics or something, but our choice possibility is much more. Okay. Now, how does it impact ophthalmology as a whole, as a practice? Is that one of the major factor is lowering of prices. See, understand that insurance company also knows that when a hospital takes up an insurance empanelment, the hospital has got a lot of benefits. They know that. It's a fact. It's an open market secret. So they are going to ask you, they are going to bargain with you for a better rate, and that leads to lowering of prices. One of the most common example is the pricing for VIA surgery, which has come down drastically just purely because of our own mistakes that we did in the past. See, time doesn't allow me to explain it further. So there is a huge lowering of prices in practice as an ophthalmologist, and as the ophthalmology practice goes, more and more cases will shift to cashless, will shift to insurance coverage, and more and more patients will come with an insurance card saying that I have this card, let's go ahead with this treatment. So that we should understand that running away from health insurance coverage for your hospital, empanelment for your hospital, is not the solution, because that's the way it's going to go in the future. That's like saying something like UPI is bad, I don't want to use UPI, is one of the examples I can relate to. But over a period of time, UPI became a very major payment modality, and it's going on. Now, overall, I would like to summarize that insurance is the way to go. Health insurance cashless empanelment will be required. There is no way that we can get away from it. Yes, we can negotiate, argue, bargain, and try to get the best deal out of it. And thing is, it's at the level of AIOS, at the level me personally, we have been in touch with a lot of hospitals, helping them out. The reason being that this is a sector that doctors are not much aware of. But it is very, very important that we get into it. We need to understand that in case we don't understand it, we need to have people with us who understand it better. So with that, I close my short talk. I already taken around 20 minutes of your time. Nothing more, and have a nice day. Thank you.